Yes, ma'am.
Good morning. Okay, so let's start with a warm-up question first. Yes. Okay, what kind of profession are you dealing with? What kind of profession are you dealing with? So what can be the answer? You can say, I'm a nurse by profession and I deal with different kinds of patients, right? Yes. Or you can say, I deal with patients. I'm a nurse. You can also say like that. What else? What else? How else can you answer this question? Can anybody try? What kind of profession are you with?
I'm nurse by profession, and I deal different kind of patient
Okay.
every day.
All right. Yes, good. Anybody else? Anybody else?
I'm a nurse by profession. I deal with various kind of patient that comes with different kind of illnesses and sometimes preventive measures in the hospital.
Okay. So how can you put it? What kind of profession are you dealing with? There's a statement in the beginning. You're a nurse, right? That'll come first. Yes. I'm a nurse by profession. Yes.
And I deal with different kind of patient.
Yes. Different kinds of patients. All right. Okay. Any other ways that you feel can be told? Can be answered?
Can we say I deal with humanitarian services?
I deal with
humanitarian services by rendering help to patients in the clinic.
But you have a designation, right?
Yes, I thought maybe we have finished that one. I don't want to mention that.
Oh, but anyways, humanitarian services, there are different fields as well, right?
Okay.
So there is you have a designation as a nurse. That's what I mean to say. Yes.
Okay.
So you're a nurse. All right. So you're a nurse. And you can say instead after that you can say whatever you want to. Like as you said, I deal with different people with different health conditions. I treat them or I take care of them, right? Or I provide care for them. Got it? Yes. Okay.
Yes, ma'am.
All right. So I hope this question is clear. Yeah. Okay. So let's move to the role play. So what is the role play? What is the setting? What is the setting?
Hospital ward.
Hospital ward.
Hospital ward. Okay. Now we are going to see the background information. Remember all the points that I told you? You have to read it in such a way that you understand. Got it? Because that
Yes,
is
ma'am.
help you to understand whether it is known case or unknown case. All right. Can somebody read it?
Yes,
You are
ma'am.
Yes.
You are 62 years old patient is recovering from surgery.
Okay. So you're 62-year-old patient. So name, the age of the patient is given. Yes. You only need to know the name.
Yes.
You can either ask the interlocutor or you can randomly keep a name. Nothing wrong. Got it? Yes. Okay. So
Okay, ma'am.
you're 62-year-old patient. Now age is 62. So what kind of patient is he? He or she?
Aged, ma'am.
Elderly. Right?
Aged.
Elderly patient. So how should your tone be?
Respectful and polite.
Empathetic.
Polite and Very
Respectful.
important. Yes. So that's the reason why we see the age. We consider the age. All right. Very important. Then, so the patient is recovering from surgery. Got it?
Yes, ma'am.
So that means what? There was some treatment given and he's recovering. All
Recovery.
right. Okay. So recovering from surgery. So surgery was okay. So now next, continue.
He or she had yesterday to remove a renal cyst.
Okay. Now another thing is, it also says that the patient is recovering from surgery, he or she. So there's no particular gender mentioned. All right. Yes.
Ma'am.
So if whatever is the gender, the interlocutor will, if he says the name, you can use it accordingly. But remember, don't change the gender while speaking, because when you're speaking out of nervousness, instead of she, you say he. Yes, this happens, very common mistake that students commit. So make sure that you don't change the gender. All right. Okay. So he or she had yesterday. So when was the surgery done? Yesterday. Got it? Okay.
Yes, ma'am.
So remove what?
Cyst, renal cyst.
Renal cyst. Okay. So what is the present condition? The patient is recovering from
Recovery.
the surgery.
Surgery.
Okay. So far it's clear?
Yes, ma'am.
Yes. Okay.
Yes, ma'am.
Next.
The operation went well,
Okay. So the surgery was successful. Good. Then
but he or she is still expressing a lot of pain.
okay. So this is the present condition of the patient. After surgery, there is a lot of pain. But when was the surgery done? Yesterday.
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 So today is only the second day, isn't it?
Yes, ma'am.
Yes. So naturally the pain will be there, isn't it? Okay. Then
And
next.
is reluctant to withdrawal from the IV morphine.
Reluctant. So what do you mean by reluctant?
Refuse. She want to take continue treatment, but he doesn't
Not
want to
adjust.
remove the pain.
Reluctant is not willing to. They're adamant to withdraw from the IV morphine, isn't it? So from IV morphine, they are not willing to withdraw. Okay, this is the
Scenario.
situation. Now, next, what is next?
You have
Continue.
come. You have come to counsel the patient on post-operative pain relief and medication control.
Okay, now here, who's the you here?
We are nurse.
The nurse.
Nurse. So you have come for what? To counsel the patient on post-operative pain relief and medication control. So this is what you're going to talk to the patient. Got it? So this is the purpose. So now, what are the other points to remember? Is there any job title mentioned?
No, ma'am.
No, ma'am.
Any time concept mentioned?
No, ma'am.
No.
Okay. Now, what is the situation? The last point is, what is the situation? What is the state of mind of the patient?
Reluctant to
Reluctant,
withdraw
not
from.
willing to take
Unwilling.
Patient
Yes.
reluctant.
Reluctant. In what? Reluctant for what?
Medicine.
Withdrawing from
Without pain.
Yes.
IV morphine.
So the patient wants the IV morphine. All right. Yes. Okay. Now, so this is a known case or unknown case?
Known case, ma'am.
It is a
The
known
known
case.
case.
Known.
Known case, ma'am.
Clearly, it is a known case, isn't it?
Yes,
Because you
ma'am.
know all the details about the patient, and you also know why are you going to visit the patient,
Patient.
isn't it? You know
Yes,
the
ma'am.
purpose. You also know what are you going to speak. Got it? You have all the details. So clearly, it is a known case. All right. Now the task. First task. What is the verb of the first task?
Explain reason.
Okay. So explain is the verb, isn't it? So explain. Explain what?
Reason.
The reason for what? Seeing the patient. That is, explain the reason for visiting the patient, isn't it?
Yes, ma'am.
That is the first task. So immediately, will you start by explaining the reason for the visit? Will you immediately go and say,
ma'am.
Tina, I have come here to counsel you regarding this blah, 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 whatever. Will you say like that?
No, ma'am.
No.
No. So what is the first point? Meeting.
Meeting
Yes.
point.
So meeting. What is the meeting? What is the first point?
You
You
have to
will
introduction.
Introduce yourself to the
do
patient.
it. Can anybody do it?
Okay,
Can anybody do it? Please.
ma'am.
Yes.
How may I address you, ma'am?
You can call me Priya.
Okay.
Yeah.
Good morning.
Good morning.
My
sister.
name is Christiana. I'm one of the registered nurses working in this hospital ward.
Okay.
Mrs. Priya, How are you doing this morning?
I'm not okay, sister. I'm having severe pain.
Oh, I'm so sorry to hear that you are having this pain, but don't worry, you will be all right. It is a normal thing to experience pain after surgical procedure. Hope I'm clear, ma.
But I feel that this pain is a bit abnormal because it's so severe. Will it be so severe after the surgery?
Mrs. Priya, it is definitely you're going to experience this because the surgery was just done yesterday. So due to the manipulation and trying to remove the cyst, that's why you are having that pain. But don't worry, the doctor has prescribed analgesic for you. So with the use of the analgesic, you feel much better.
Okay. All right. Okay. So now, Christiana, we
Yes,
did the
ma'am.
first task. Have we completed the first task?
Not really.
What do you feel? I'm sorry. What do you feel we have missed out? You explained the reason.
Reason.
Did you explain the
Well,
reason?
no, I've not explained the reason. I'm just trying to address patient concern.
Yeah. All right. So what, see, when you keep, when you keep explaining so much in detail, you will not have time. Got it?
Okay.
Yes. So you have to make sure that it is short and crisp so that you get to the point. Yes. All right. But it was good. It was a good try. All right. It is correct also. Nothing much wrong, but try to make it short. Got it?
Okay. Okay,
Because
ma'am.
you have other things to explain, isn't it?
Yes,
Yes. There are certain things that you need to explain and convince the patient. So that will consume a lot of time. So based on that, you'll have to plan accordingly. All right.
Okay.
So good job. Anybody else would like to try? How will you do this? The first task? Anybody? You can say, good morning.
Yes, ma'am.
I'm, yes. Anybody? Yeah, please.
How can I address you during your time?
Same name, same name. Yes.
Good morning,
Yes,
Maria.
start. Good morning, sister.
I'm Smita Joseph, one of the registered nurses in this facility. Maria, this morning, how are you doing?
Sister, I'm having severe pain. I'm not okay.
Oh, Maria, I'm so sorry to hear that you are in pain, but actually the medicine is running. So the doctor has decided to take out the medicine. So you just cooperate with us. Doctor will add another medicine instead of this morphine. So you will be in comfort with this medicine, another medicine, Miss Maria.
Okay. Who's this? Who's this doing the speaking?
Smita.
Smita. Okay, Smita, you directly went to the oral medication. Okay. Yes.
Okay.
Yes or no?
Yes.
So what is the first task? You have to explain the reason for visiting the patient. Yes. The task that you
Yes.
did is about, the oral medication, which comes in the, I think, fourth task, right? It comes in the fourth task. Am I right?
Yes. Yes.
So
Yes.
what you have to do is first you have to explain the reason for visiting the patient. All right. So don't you think you can say like, good morning, Tina. This is Yashoda, one of the registered nurses working in this hospital. And I'm here to counsel you regarding the post-operative treatment. You can say like that. Yes. So you're done your what explanation? Why are you going to meet? Why are you meeting the patient? Are you getting my point? Yes or no? Yes or
Yes,
no,
ma'am.
guys? Yes.
Yes,
You
ma'am.
can do that so that in one attempt you finish. You also save time, isn't it? Yes.
Yeah.
And after
Yes.
that, you can ask, how are you feeling today? So both the tasks are done.
Okay.
Yes. So time is also saved.
Yes.
Got it? Yes.
Yeah.
Smita, are you getting me?
Yes, ma'am.
Yes. So explain the reason for seeing the patient. You introduce like that, and then you ask, how are you feeling. What is the sound? Yes. So when you do this, now you have already introduced yourself and you've also told the reason for the visit. Yes. And then you're asking, how are you feeling now? Now the patient will say, I'm not okay. I'm having severe pain. Then you will explain, you will tell the patient that this pain is natural after the surgery because it is just the second day, isn't it? Yes. Being a second day, it's natural. And this pain is normal. There's nothing to worry. It will heal soon. The pain will reduce little by little. You can say like that. Got it?
Yes, ma'am.
Yes? Okay. Now what is the second? Reassure patient about pain. All right. So that's what we said now. So example, it's a part of what? It is natural and it is part of healing process. It will slowly reduce. You will be fine soon. Got it? This is what we have assured now. Am I right, guys? Are you getting me? Yes?
Yes, ma'am.
So what you do is this is a concept. Now, how will you do it? You can say, oh, I'm really sorry to hear that. So as soon as the patient says that, I'm having severe pain, what will you do? You will say, oh, I'm sorry to hear that. Yes, I'm sorry to hear that. I can understand that the pain is severe, but please don't worry. You'll be fine soon. Okay? It is because the second day you are having this pain and it is natural. You have to make them understand that it is normal. All right? Because the patient is feeling that it is abnormal, isn't it? Yes. So you have to assure the patient saying that it is normal, nothing to worry. You will be fine soon. Am I clear, guys? Yes? So far? So you have given the assurance. You have also told how to, I mean, how will it be? Okay. Now next is find out if the patient has been doing any physical activity. Okay. So this is also important that you need to know. Now comes the inquiry part. So now you start questioning. So how will you do this? How will you do this? How will you ask this question? After saying your pain will be fine, I mean, you will be fine soon. Immediately, what will be the next point?
I asked Ma, have you been trying to sit up from bed?
Have you tried to?
Sit up from bed.
Okay. Have you tried to get down from bed? Have you tried to do any physical activity? Yes. Did you try to move around? You can say something like this. Yes. All right.
Yes, ma'am.
Okay. Now the patient will say, no, sister, I didn't do any physical activity. I did not get down from the bed because I was scared that the pain might increase. Because of the pain, I did not get down from the bed. I was even scared to move around. Got it? Yes. Okay. Then what next? What else? How else can you ask this? Anybody would like to try this? Second task?
Yeah. Yes. Mrs. Priya, I think it is very important for you to get up from bed and move around because this is going to help you and help your wound to heal rapidly and you get better. And secondly, it will prevent blood clot or the blood circulation and you feel much better. By lying much on the bed is not going to help the situation on ground. The pain will be intense the more. I hope you understand what I'm trying to say. Yeah.
Okay. Now, is it Christiana? Yeah?
Yes, ma'am.
Okay. So, Christy, suppose the patient, that is, suppose I say as a patient that, sister, I understand what you say, but I'm having severe pain. I'm not able to move. It's so painful that I'm scared to even move. All right.
Yes, ma'am.
So,
Yeah.
how will you convince?
Okay. Yeah, Mrs. Priya, it is normal to feel that pain, but the more you try to get up, the better it is for you and your pain will get better. But while lying on a particular position, it's not going to help the issues. And there can be a kind of stasis of blood in that particular area because the circulation of blood is not properly moving. So when you try to get up from your bed, it will help you to heal up fast, and the doctor will also look at discharging you. And trying to get up from bed will also try to help you to also relate and prevent constipation and nausea that can arise from the effect of the drugs that you are taking. I hope you understand what I'm trying to say, Mrs. Priya.
Okay, Christy, that was a good
Yes,
try.
ma'am.
But let me give you a suggestion. Okay, see, we are going to convince the patient. We have to convince the patient. I mean, we have to stress the importance of moving around. Yes, movement, physical activity is very important. So when you're talking about the importance of physical activity, yes, we'll have to tell them about, like you can say, like, what are the points that you can say? It will, the important point that is, that comes for movement is, it will help to recover soon, right? Your recovery will be fast if you move. Am I right?
Yeah.
Yes. So that is the main point. This point, if you make the patient understand, even a reluctant patient will accept what you say. Am I right? Do you agree with me? Yes. If you
Yes,
want recovery, that has to, I mean, a quick recovery, if you follow these things, definitely it will happen. But if you stick to the worries, I mean, if you keep thinking that it is paining, I can't do it, then your recovery will also get delayed.
Delay.
Yes.
Yes, ma'am.
So when you say this,
Yes, ma'am.
definitely not even a single patient will like to stay in the hospital. Yes.
Yes, sir. Yes, it's true.
So that is the point which will help you to convince the patient. I hope it makes sense. Yes.
Yes, ma'am.
So now let me explain. After telling this, you can say, let me explain how it happens. Then you can slowly, one by one, you can say, it alleviates pain. I mean, by doing physical activity, what are the benefits? It alleviates pain. Then it decreases what? Swelling, isn't it? It decreases swelling. And it also helps in what? Good blood circulation. And another important thing is it also helps to, I mean, it reduces the blood clot, isn't it? Yes. So all these symptoms are what? Symptoms of recovery. Am I right? Yes. So when you say this one by one, and this is how it helps in quick recovery. But if you don't do any physical activity, all these things will not happen, isn't it? Yes.
Yes, ma'am. Yes, ma'am.
So obviously what will happen? The recovery will get delayed. I understand that you have pain, and as I said, it is natural, but you can start with walking, isn't it? Nothing much. You can start with walking for few steps. Slowly, little by little, you can increase the number of steps. You can take rest, again you can walk, then you can take rest, and again you can walk. You can say like this. And if you want, I can also recommend that. I mean, I will also ask a physiotherapist to come and help you. All right? Yes, come and help you to do some activities which you can do without much difficulty. I hope you get my point. What do you say? Would you like to do that? Then the patient may say yes. Yes. Got it? Yes, because definitely because the patient is elderly patient, right? So they will have that fear of falling down or not able to balance. So if a physiotherapist is there, they get help. Am I right, guys? Yes. Hello.
Ma'am.
Are you people there? Yes.
Yes, ma'am.
Okay. So
Yes,
so
ma'am.
far,
Yes.
I hope it is clear.
Clear, ma'am.
Yeah. Clear,
Okay.
ma'am.
Anybody has any doubts so far? We have done till I think.
Ma'am,
Yes. Yes.
ma'am, just like the patient is saying, I have severe pain. So at that moment, we need to ask the patient the pain score.
Pain score.
Yeah. The patient is saying, I have severe pain. So we need to ask
You
about
can
pain
ask, but as I said, it is understandable, right? It is understood that after the surgery, pain will be severe. We don't even need that pain
Okay, ma'am.
scale, isn't it? It is understood. Yeah. It's
Okay,
obvious that
ma'am.
after the surgery, the pain will be there. It is going to be severe only, isn't it? Yes.
Okay, ma'am.
Because it is part of healing process.
Thank
It
you.
is understood. So that is not
Yeah.
required. So you can just do, so far, whatever we have done, we can do that. All right? Yes.
Okay, ma'am. Thank you.
Yes. Any any other questions? Any other question, guys? Any doubts? All right. So we'll do the rest tomorrow. Yes?
Yes, ma'am.
Okay. So if you have any
Yeah.
doubts, you can please make a note of it, and next day you can ask me. We'll clarify that. And as I said, if you have any other task, role play, which you feel is very difficult, you can share that as well. All right?
Okay, ma'am.
Yes. Okay. Good day, guys. Thank you. Take care.
Ma'am, nobody wanted to speak with each other.
Sorry?
Ma'am, actually, every day I think that someone will speak with me, but I don't know.
Yeah, you
how I
can, in the group, you
say
can
to
ask, you can
someone, they
find
can
out,
speak in.
you can get in touch with people who are around, in the group, right?
I love Ma'am Christiana speaking.
Okay, then
I
approach
like
her.
her sound.
Let me suggest for you. Look for Mika. Look for Mika.
Okay,
Mika.
All right. You
I
can do
love your
that in the group.
speaking,
You
Miss
can ask.
Christiana.
Okay. All right. So carry on.
Thank you, ma'am.
Okay, guys.
Thank
Thank you
ma'am.
so
Thank
much.
you.
Take care. Have a good day.
Thank you.
Yeah.
Thank you, ma'am.
Thank you, ma'am.